So thank you so much. So what we're going to do is we clearly went over the time limit of 4 o'clock, but also we realize how important the topic could be for some of you who may have some burning questions. So for maybe 5 minutes, we'll have the panel of speakers here, and if you have any questions, depending upon the relevance of the expert, we will take questions and answer them. Thompson, Dr. Thompson, maybe. Any questions? Just there's going to be a mic coming to you for a second. Hang on.
Hi. How much salt is okay and how much salt is too much?
The recommendation is 1,500 milligrams a day. You'll see on a nutrition panel, which I hope that everybody in the audience acquaints themselves with. Everything that you eat will have a nutrition panel unless it has a rind or a peel. And then you can Google it, but everything contains a certain amount of sodium. And if you look at the nutrition panel, it has percentages. The percentage is based on a 2,000 milligram daily dietary allowance. But really for heart and vascular health, it's about 1,500 milligrams a day. And anything above that is really too much. And people say, well, you need salt. And yes, you need salt. It's the most important electrolyte in the body for every single biochemical process. But 1,500 milligrams a day is more than plenty to sustain you.
And that'll come to roughly 3/4 of a teaspoon, roughly. One second. Yeah.
Would you just talk a little bit more about the L-carnitine?
Sure. I mean, L-carnitine, phosphatidylcholine, choline, lecithin, they're all very important nutrients. None of them can get digested by a human body. They have to be digested by the microbes that live in our gut biome. They are implicated in the development of TMAO, as I was describing. And TMAO, in certain circumstances, and in very important circumstances, degrades the integrity of vasculature by changing endothelial function, which is the cell layer inside of the blood vessels themselves. It also is implicated in platelet reactivity. So when I showed you that picture of how a heart attack happens, the endothelium is disturbed and the platelets are hyperreactive. So platelets, when they're hyperreactive, it's like a thickening of your blood. It's not really thickening, but when they're hyperreactive, they're super sticky, and they'll attach onto things like your endothelium. They will that whole process will lead to the deposition of cholesterol inside the walls of the arteries. So as nutrients, they're very important, but in the way that we eat them, just like we eat sodium, they are utilized in non-whole food plant-based ways as thickeners and emulsifiers that are not necessarily good for your health, and also as dietary supplements that you can get at the grocery store, at GNC, that people often use to increase their bulk or increase their muscle mass, that can be very detrimental to your health.
So you're saying that no amount of olive oil should be incorporated in your diet?
Correct. Yeah. Yes. So basically, any oil, the studies have been looking at the lining of the arteries and how they get injured through oil, and they compare different oils. So all oils compare the same way. So it's best to consume the source in a little limited amount. So instead of peanut oil, a little bit of peanuts is okay. Instead of olive oil, some olives are okay. So the source has fiber and other components in the complete package, like the symphony that Jean mentioned. So when you take just the oil out of it, you're actually missing out on the fiber and other good stuff, and it's processed naturally, and it is just creates more inflammation. So there's plenty of ways to cook without oil, with how Jean showed. And I come from India, and where every meal that started with the seasoning with oil. With some mustard seeds, they will pour oil on the pan, and they will season it, and that's how every meal is cooked in India. And I come from that origin roots, Now I don't cook with oil at all. I just use water or vegetable stock to season. So it's doable. So I like, it's very easy to kind of conceptually start thinking that, oh, this is going to be hard for me to do. This change is going to be hard. And if we just break it down and think about it in phases and doing it like easing into that, it is so easy, and it's all worth it. So
I just want to, I'm sorry. I just want to make a very important point, because when we talked about Dr. Esselstyn, Ornish, Pritikin, they are all oil-free and in some, and almost exclusively nut-free, so you're not getting any of that. And I'm just speaking now as a cardiologist, they are not the recommended, they're not the standard recommended diets, because the American College of Cardiology, American Heart Association has felt that they're too difficult to follow. And that's one of the sort of the downsides of those dietary practices. So, and the reason I'm saying this is because DASH diet, when they looked at the DASH diet, and the reason they recommend the Mediterranean diet is because those populations got a lot of olive oil. So I don't want, it is clear that oil-free is the best way, but I didn't want there to be a discrepancy like, yeah, but she said DASH and Mediterranean. There is clearly a difference, but there is a reason why. Olive oil was never something that we know lowers cholesterol. It's actually the dietary practice that is essentially plant-based whole food that lowers the cholesterol, if that helps.
So that's a good point. What I don't know if you heard that or not. The question was, so is it true? Are you saying that using olive oil to reduce cholesterol and improve health is not correct? And that is a classic example of how, we have been hearing and we've been conditioned to think that one food is going to fix everything. So, I mentioned, right, blueberry is the superfood of the month. Olive oil is the thing of the month. And it's historically in science, when we look at all the scientific literature, anytime we look at studies that looks at one particular superfood, it turns out to be bogus or not a robust, sound science. It's always the pattern of food. What's in the total mix? By the end of the day, what are the food ingredients that person has eaten? Or by the end of the week, what have they eaten? And in a Mediterranean diet, which is different from a standard American diet, right? In a Mediterranean diet, chicken is consumed once a week. And in tons of fruits and vegetables, they use nuts, and they use olives and olive oil. And so that is a shift from a standard American diet. So when we do a study and publish headlines, and you see it in the news headlines saying, Mediterranean diet with olive oil reduces heart disease, heart attack, what they're saying is that they're compared to a standard American diet, there is a drop of 20% risk or 50% risk in heart attacks. So relative to horrible, right? Bad stands out great. So that's what you see in the headlines.
It's true.
It's so, and I've done an entire lecture on how to interpret media and nutrition, because the media runs by making sure that the headlines are dramatic. They run by oversimplification of data, and it's hard. It's going to be boring if they explain the whole science in the headline. So they have to oversimplify it, and when they oversimplify it, the nuances that really matter gets lost. So, I mean, we can talk a lot more about it, but that's kind of the answer for that. Yeah.
So do you recommend a whey-based protein? If you're very active, you don't.
No, you want to talk about that?
Go
And
ahead.
the same with casein?
Yeah, so they are both coming from dairy. They're both coming from a dairy product. I tell clients who come in and they're like, oh, I love my protein smoothie with my whey protein. I say throw it out immediately. Like I just, in my mind, there's so many better ways to get protein, as we talked about. Never. Nope, never.
So the
Get it out
question
of
was, no matter how much exercise we do you not recommend like a whey protein supplement powder? And the fitness expert
Just
saying,
like oil? No. And if someone who wants to add an additional protein source, and there's some people just in their own head, I haven't had additional protein source that's not coming from a whole food in so long. Because in my mind, when you're adding a protein source, there are some good plant-based options, but it's still processed. So why not just make your smoothie from real food? Oh yeah, yeah. And the supplements, just like Jean had said, you do not need any supplementation other than B12 and vitamin D. I tell all my clients, if you're taking a multivitamin, you're just wasting your money. I have clients come in with trash bags full of supplements, and my heart wants to explode because they're expensive.
They are.
And as Amy pointed out in the slides, a lot of the athletes and bodybuilders, they are not using the protein powders. I think they're getting the
Getting
protein from the whole
Yeah, these
foods.
are the vegan. I mean, if you're not a vegan bodybuilder, you're taking lots of supplementation.
Okay, there you go.
I have a question. I went plant-based 2 months ago. I'm just curious as to what point do I need to start including a B12 vitamin?
Oh, so the B12 stores that are in your liver usually last for many months to kick in when there's a gap. But I think there is no harm in starting now. So I recommend once a week, 5,000 micrograms once a week. If you do it once a week, if you do it daily, 1,000 micrograms. So for convenience, just once a week is cool.
What about sugar substitutes, artificial like stevia or other types versus date sugar, or what are the good ways to sweeten up a meal?
It's a good question, Gary. So no, it's very, very good. So to sweeten up the meal, I'll give my example. My day, I use oatmeal or quinoa for breakfast with lots of fruit, and I would chop up a date. I'll chop it up and throw it in there, or an apricot, 2 apricots. I'll chop it and throw it in. Just doesn't take a lot. Once we shift more towards plant-based diet, initially during the shift, that is good. When the sugar is less in these things, it is going to feel like it's not enough because you're coming from, your taste buds are so used to a hyper-concentrated load of sugar or salt. So that's why when people try to shift the diet, you will hear saying, that broccoli tastes like cardboard, or that carrot is like cardboard. That is true, because the taste buds are so much elevated. The expectation of the taste buds are high here, super saturated, and so it takes a few weeks to kind of bring that threshold down, and then the strawberries are tasting like great. And that 1 date and 2 apricots is going to be like sugar, enough sugar.
Can I jump in for a second? I'm mic'd up. But people, will bring to our school food and leave it in the teacher's room. And I used to love Dunkin' Donuts, honey glazed donuts. So, if you bought me a box of those, I'd be down for 3. Don't get between me and the box because you'll get hurt, okay? And so I came into and I'd been plant-based for a couple of years, and I walked in and went, oh, honey glazed. Oh, my God. There was 1 left in the box, and it clearly had my name on it. And I took a bite of that, and I went, did they change this? Is the recipe gone? This used to be so good. And if you had ever said to me I'd spit out a Dunkin' Donuts donut, I would have said you're on drugs, because it's not happening. But I did. I split it out because your taste buds change. You can actually start to taste the food. And I did an interview with, his name is Andrew Spudfit Taylor, and he realized he had such severe depression, and he said, I have to change it. And what he did is he went for a whole year and he ate potatoes. That's it. And because when you're an alcoholic, you can just say no to the alcohol and walk away from it. But when you're a food addict, you can't just walk away from food. So what he did is he made his food as boring as possible and just ate potatoes for 1 year. And when he got back and started eating it, they had a big party when he ate his first meal, apart from potatoes. And he ate a grape, and he's like, oh, my God, do grapes always taste this good? And he couldn't believe the flavors and how wonderful the food tastes. And it's amazing when you actually start to get back and you taste the food for the first time after a while of transitioning from this. And you're like, oh, my God, do grapes always taste this good?
Stevia is probably the closest that comes to a natural leaf that from which the sugar is made. Still, ideally, if you have a stevia leaves that you can just use like a hot tea and then use that liquid, that's the best way to do it. But if not everybody can do it, I don't have the time to do it. So I buy the stevia drops and I use like 1/4 of the recommended dose. You just need a tiny bit. So that's what I use. Do you have any?
Yeah, I
Cup
think
of coffee,
too,
tea.
what's important is to think, you know, we talked about when you're used to eating fats and you're used to eating oils, your tongue is coated as Jean was saying that you don't taste the food. And once you start to make that transition, I had a woman, she's like, there's no way I can stop putting milk and sugar in my tea. And just a couple months ago, she's like, I drink it black and I don't even miss it. But if you are someone, a good substitute, I have clients use lemon. Just squirt some lemon in there and adds a ton of flavor. It's a different type of sweet, but that's a nice alternative.
Another good choice is just maple syrup. Just add a little smidgen of maple syrup. It's very sweet. You don't need a lot. And, you know, that was one of the transitions or one of the things I suggest for people to help transition into it.
And always during transition, it's going to feel like it's not enough, and that is something to be expected. And it'll and you can also start to decrease the dose. Initially, it could be 2 dates, and then you go to 1 date, you know, in your porridge or whatever.
How important or necessary is it to have your doctor following up on you within, you know, like I go every 6 months, but if I started this and you're saying how dramatic it is in 2 or 3 months, is it important to see your doctor?
Correct. I mean, if you have diabetes, if you're on insulin, if you're on medications for diabetes, your sugar will change week by week. So I think, as Jean mentioned, it's always good to, when you're trying to embark on such a change, it's good to talk with your primary care doctor, tell them that, you know, you've learned about these things, you want to try this, get a baseline blood work, and then get a kind of a schedule, a follow-up schedule arranged so that you can check in for any changes, because especially for insulin dosage and all, that need to be closely monitored and changed. For blood pressure medications, so Dr. Thompson could maybe answer, if you are having a patient who wants to embark on this journey, patient is on 3 BP meds, when would you bring back for a follow-up?
For me, anytime my patients are making big dietary changes, I usually have them follow up. If they're really committed, they're following with, you know, they've got their support. I usually have them follow up within a month to 6 weeks, actually, because your blood pressure will change dramatically even after a big meal. So if you are really consistent with your changes, after only a few weeks, we can eliminate many, many medications. I would also say this, just as a specialist, you know, I am a huge, huge proponent of the plant-based lifestyle, but the disease that I treat, unfortunately, it doesn't all go away. And looking at Dr. Esselstyn, for example, he was so good at showing what dramatic changes can happen to the heart and vascular system, and just by doing this. But I would also say, we always want to make sure that we understand that if you do have known cardiovascular disease, this isn't a replacement. It will absolutely 100% prevent the progression of this disease, and in very dramatic ways reverse the disease, but it won't make it go away. And so I hate to be the principal's office again, but I just want to make that point, because I love when patients come and they're motivated and to give them support in their journey, but it's still a journey, and we have to work through it day to day.
Yeah, I mean, so prevention is better than, you know, trying to deal with it later on after the fact, and so it's always good to keep that in mind, I think. Okay, I'll come back here.
So you gave advice that the first steps would be to clean out your cupboards. What advice do you give if you are still living with people who are not ready to receive the message?
And that is a tough one to go through, because you may have some parts of the family, and actually Chef AJ has a lockbox she puts in a refrigerator, and she here's the food that I can't have, because it's tough, because if it's in your house, it's in your mouth, and it is a tough decision. And I've known other people who have 2 refrigerators, and that they've solved it that way, that they put the refrigerator and, you know, so here's the other one, and literally they have a lock on it. I mean, on that refrigerator, so that they can't get into it. Because for me, I know I'm an addict, you know, and I know that if it's in my house, I'm going to eat it. So it's hard for me, thank goodness I have my husband who is not, but if you're dealing in a situation like that, you just have to draw some clear boundaries, and just say, you're going to keep your food over here. I can't see it, because a lot of people are food addicts.
With pasta, do you have to eat all brown or brown rice or whole wheat pasta or stuff, or can you eat the white? And the same with potatoes. Does it all have to be sweet potatoes or?
Yeah, I think any of the grains, or pasta, bread, and those kind of the whole grains is always better, because in a white pasta the fiber is removed, so there is 100% of the fiber is gone. So without the fiber, you're losing a huge benefit from that whole grain food, which is the pasta. So always whole grain is what is recommended. So whole wheat pasta, if that is the case.
Just an added note on that for the whole wheat pasta, a lot of times you don't know how long that pasta's been on the shelf, and sometimes the whole wheat in there starts to break down and it has a bitter flavor. So it's not, whole wheat pasta is, to me, I've never been a fan of it. So instead of using the white pasta, what I do is I use the rice pasta, which cooks a lot like a white pasta, has the same texture and feel, but it's not, the broken down grains. So arsenic. Right, and you have to make sure where your source is coming from, because the arsenic was in like the south, in where they were using a lot of the plantations, and they converted the rice fields, or converted the cotton fields into rice fields, and so there was a lot of arsenic that they were using in pesticides. So you want to make sure you understand where your rice is coming from and where the base ingredient is. But if you're cooking it like in a pasta, you're cooking it in a whole pot per se, a lot of that is coming out into the water.
There are also some great bean pastas, and if you've never had spiralized zucchini or spiralized vegetables, a lot of times we crave pasta because we think of when we were a kid and we had pasta and meatballs. But if you can substitute as a vegetable, I have so many clients who are like, I don't miss pasta at all anymore, I use zucchini. So that's another option too.
Correct. Yeah. So they're high in calories. Recommendation is 2 tablespoons, 2 to 3 tablespoons a day, not more than that. But if you are an athlete, if your physical activity is high, then your caloric needs are high, and that's when you can start to increase the portion size of the nuts. But nuts do fill an important necessary niche, which is the healthy fats that we do need. So nuts and seeds are definitely consideration there. It's just needs to be it has its place, and the place is a small place.
I have several questions. We've been plant-based for 6 months, and we make homemade almond butter sandwiches, and eat that on a daily basis. Is that something that we should be doing? Also, maple syrup on our oatmeal each morning. And also, Amy, you mentioned something about apple cider vinegar.
Oh, yeah.
Yeah, so those are my 3 questions on what we should be consuming on these products.
Yeah. So for the almond butter, I mean, any food, it's just there should be a variety. Yeah, I think the portion and the frequency is something we need to look at, because there's no food that is healthy if that's the food you're having for breakfast, lunch, and dinner, and there's no variety in the meal pattern. So there should be a variety. So I think I'll just look at, what is the total package you're getting at the end of the day, rather than focusing on one food. I mean, you're probably hearing the theme from me again and again. So now focus on one food. It's just the variety that's key. And a little bit of maple syrup, I think it doesn't hurt, as long as you're physically active and keeping up with all of that. And the apple cider vinegar.
Yeah, in Dr. Greger's book, How Not to Die, he actually talks about the benefits of vinegar. And if you were here when I spoke last year, I talked about flavoring with flavored vinegar. And I think that's just such a great tool to use for people who are looking for more flavor in food. What was the first question you had asked? Oh, the nuts. I think what's important to remember about nuts is they are high caloric food. They're a high nutrient dense food, but they're also a caloric food. But I also warn clients to stay away from roasted and salted nuts. So you have a whole spectrum. Within these healthy foods, you also have a healthier aspect of a healthier food. So you want to think about that too.
So the question was, where does almond milk fall in all of this discussion? So almond milk is not an essential, nutritionally essential food when somebody is trying to improve their health using plant-based nutrition. It's just there because somebody is so used to milk. If it's just a culinary replacement, just making sure that habit, you can continue that habit and that use purpose. But more than that, nutritionally, you can get the calcium from greens and beans rather than the fortified, calcium-fortified almond milk. It's more of a convenience. If you want to use it, you can use it. It's not essential.
Hi, I have a question for Jean. You talked about a man that had blindness and also neuropathy.
Right.
What is his name again?
Eric Adams.
Eric
He's the Brooklyn
Adams.
Borough president.
Yeah, because I just been recently diagnosed with I'm losing my vision in one of my eyes and starting to start in the other, and the neuropathy. So I totally resonated with that story. So I want to check out your video.
On my website, the interview is right there. He's
Right there.
amazing.
Thank you.
And there are studies, actually, that's a powerful anecdote, one story, but actually there's been studies done on diabetic patients with neuropathy, with retinopathy, looking at plant-based nutrition. It's a small sample. I like studies to be robust and large sample and all, but sometimes you don't get that much. But this was a small sample study that looked at neuropathy, pain, and diabetic patients, putting them on a plant-based diet, and the pain went away remarkably, in many of them 0 in 16 days.
Wow, yeah.
In a matter of
I've read a
16
lot-
days for
I've read-
neuropathy. And eyesight can change. I know that Amy mentioned a couple of case studies as well where the client's vision improved. I don't know if we were noticing that. So all of it is now we know that in glaucoma and other eye diseases, inflammation plays a huge role in causing those eye problems. So that's why you'll start seeing the vision improve in patients as like a positive effect when that was not even the target when they were trying to change the diet.
Well, I had, I what do you call that? Check out Dr. Bernard quite a bit on reversing diabetes. And I just wasn't sure how much of the reversal goes to things that have already been, broken down in the body, such as, your eyes, such as neuropathy, and so on and so on. I knew glucose comes down rather quickly because when I started the whole food plant-based, within a week, my numbers were almost down to normal if I was completely strict. But I wasn't sure how that would affect like my eyes and my feet. So thank you.
It's worth a try, yeah.
I can't tell you how many clients sound exactly like you. And I had actually not heard of this before, but this is great. Also, purple carrot that I mentioned, I have clients who never wanted to cook, and they were like, this purple carrot thing, I'm really enjoying cooking. So that was a nice process for a couple clients because they didn't cook, and it helped to teach them how to cook. This sounds like, for what you're looking for, this sounds like a great solution.
These recipes came from Kim Campbell, and I do actually a cooking show with Kim Campbell on my website under videos. It's called Plant-Based Living with Kim and Jean, and she has, in my humble opinion, and I think the other intervention my husband wants to do is with cookbooks, because I think I have them all, and he wants no, you're cut off, stop, and he's gonna consider intervention at some point, but. Kim Campbell's book, in my humble opinion, The Plant Pure Nation and her Plant Pure Kitchen are two, in my humble opinion, the best, cookbooks. Every recipe in there is a winner, is a game changer. For me. And I've taken a lot of her recipes and modified and changed them, and we talk about that all the time. But a lot of these are her recipes, and they're done through Plant Pure Nation, and the food is amazing. So you can just put these into, and I have it's called the Mini Hot Logic, And we use them, especially for traveling. We can plug them into the car, and the Mini Hot Logic heats the food up. This tray, this literally was from the top of it, and it fits in there, and it's a pound of food. And so it's easy. So if you don't want to cook and you don't like to cook, this is it. Or purple carrot or things like that.
I would say this though too. Sorry, I'm just gonna weigh in because it was last year when I kind of switched my whole life. And I was sitting in that chair over there, and I asked the nutritionist. I said, "How do you cook a beet?" Because I don't know how to cook. I mean, I learned how to cook watching Rachel Ray, and that's how I decided I would put like meat in an oven. I do not know how to cook. And she said, "How do you think you cook a beet?" And I was like, "Well, that's why I asked you." And she said, "You can boil it, you can saute it, or you can roast it." And then I said, "Well, how do you cook this?" And she said, "You can boil it, you can saute it, and you can roast it." And so for somebody who works 60 hours a week and has a busy life with busy kids, like I don't have time to be Julia Child, but I can boil something or saute it or roast it. So I'm saying this personally. I was very daunted by the fact that I was going to have to learn new skills. It's a different vocabulary, but I went to home ec in 5th grade, and I can do those things.
Yeah, and it's also cooking in advance. Like, I work a ton. I love what I do. I love to work. And I just cook in advance. So just like that, like I'll roast a bunch of potatoes or I'll cook a bunch of wild rice, and then I take my little glass containers and I scoop a cup of wild rice in these containers, and then I freeze half of it. I mean, I can put a meal together in 5 minutes flat, and it's healthy.
It's true.
I have a number of people who can attest to that. So again, I think I didn't love cooking until I went plant-based, and you are a spring chicken, my dear. I have clients in their 80s who have made this transition because they're like, heck, I'm still here. I better as well feel well. So I think that's a big message to get across. It is never too late. And 68, please.
Did you have a question? I know you. Yeah.
No one has really addressed non-organic versus organic. That was one question. And might you in the future have someone speak about the water situation on the Cape?
Okay. So the questions were nobody addressed comparison between non-organically sourced food and organically sourced food, and the other question was to talk about the water situation. Oh, I see. That's a request. Okay, so we'll just address the first question here.
Well, just to quote Caldwell Esselstyn, when asked about chicken is chicken, and although organic in most cases is better, it's still chicken. And he'll often say, would you rather be shot or be hung? As awful as that is, but he's saying it's still chicken. To your body, it's still chicken. So when clients are like, oh, but I eat organic chicken, I'm like, well, it's still chicken breast. So that is my short answer, and I know not very appropriate.
So because the protein itself is the main issue in many of these things, so the animal protein, whether it is free range, whether it is organic, no matter how it is, how it physiologically works on the cells doesn't change. How it can damage the DNA of the cells to create cancer cells doesn't change. If it is not organic, there is always additional layers of toxins that you can introduce. One of the best ways to actually reduce the toxin load if somebody's wanting to be more organic life is to actually start eating more plant foods. Because plant foods are eaten by herbivores, which are eaten by carnivores, if you look at the food chain, right? So it takes like 1,000 units of plants to support 100 units of cows, and the 100 units of cows or goats can support 10 units of humans. So all the toxins in the ground that enters the 1,000 units of plants end up funneled into the 100 units of herbivores. So that means gram per gram, a gram of beef will have more concentration of toxins and chemicals than a gram of broccoli. So the best way to actually offload toxins and is to actually start eating at the lower end of the food chain, which is plant foods. That's the easiest way to do it. And if you choose organic vegetables and fruits, that's even better if you can afford it. But it's not, and then there are things you can choose, like the dirty dozen. You could try to avoid the dirty dozen if you can, because not everybody can afford organic things all the time. So it's all relative. I think eating any vegetable is better than not eating vegetables. I think that's the way I start. And then you can start to pick and choose a little bit more.
I was just going to say one other thing. When you're talking about organic versus non-organic, when we talk about vegetables, and maybe you can speak more to this, but when we talk about vegetables per se, there are vegetables that came from the valley. I used to live in Texas, the valley that's between Texas and Mexico, and that's where most of that in California are where most of the vegetables that we get at the grocery store come from. So they were grown to and then allowed to mature to a certain extent, picked, and then shipped. If you look at the nutrient value of something that was grown to not the peak of maturation and then shipped versus something that grew in Brewster and that went to the farmer's market on Thursday, the nutrient value of that food, whatever it is so significantly different than the nutrient value of something that came from far away. So I think that that's just another way to look at it, just the nutrient value itself.
But also, too, if you go to the frozen foods, a lot of those are picked at the height of freshness and maturity, and then they're flash frozen. So that's another good choice as well.
And just to go back to the chicken, only because I lived a life, I lived a life on chicken and broccoli. And even organic chicken is injected with sodium. And as Dr. Thompson was talking about, I mean, if you really knew the whole chicken and meat process, again, if you can eat it, oh. But I think that's important to think about too. So even if you're getting organic chicken, you're still getting chicken that was injected with sodium because they're trying to increase the weight to charge you more money. So I think that that's also important to note.
So we'll take that question and one more question, and then that person over there.
First of all, I think you've done a wonderful job, and I thank you all four. So, but I just want to say, at my age, I really think socializing is so important, and not many of my friends, they laugh at what I'm doing right now, and it's not quite what you said we should do. And I don't want to give that up. And if I'm invited for dinner, I mean, I don't want to say, well, I can't come because, you know, I won't be eating your food. So can you do this partially or not? I mean, really?
Can I answer
I mean,
that one?
But wait, well, okay, but one other question, too, is I've heard that organic isn't always organic. I know that they're saying the avocado's coming from Peru. They're growing in one field right next to another field. And I've just thought, how, with all the winds and all the pollution and whatnot today, how do we know we're really getting organic?
I'll start with the family question or going out because, first of all, my family is not. And so I've learned how to deal with it. A lot of times I bring my own food. But let's focus on what the whole point is of what you want to do. You're socializing with friends. So if you're going out to eat, then you can learn how to order from the menu so that you can eat plant-based. Or sometimes, like, I'll even bring my own food with me. I totally bring stuff in my purse, and I have a Mary Poppins purse, and I'll just be pulling things out from it, and, you know, and I'll be just eating along, and nobody knows anything else. A lot of times, I'll bring my own food with me, and I'll plug in. Like, it's when we go to the carnivores, like, as soon as I get to the house, I plug in my mini Hot Logics, and then I go enjoy the company and the family, because that's the whole point is you're socializing. You're going out to do this as an activity to be amongst friends, okay? So don't feel that you have to give that up, but just let people know, hey, I'm eating a little bit different, and I brought my own food. It's okay.
Well, and I think that's a question for a lot of people. They're afraid about the social stigmatism. My friends think I'm crazy. And I think it's so much easier than people. For me, it was actually really easy. It took my friends a really long time to figure out that I wasn't eating meat and dairy. I don't know what that says about some of my friends, but no, I'm just kidding. But you can, once you kind of figure it out, and I work with this a lot with my clients, is how to order sides or how to get a salad and get this. I mean, you can go to any restaurant and get a salad. Honestly, like, it's so much easier than people think it is. And going to a friend's house, I always bring something. I always bring something from everybody to enjoy. And the young woman who asked the question about someone in her household wasn't willing to transition, so what? It's your life, it's your path. And if there are trigger foods for you, have them put it somewhere else. But what I find so incredible is the more you stick on your path, the more you have this positive influence on others. I can't tell you how many of my friends are now like, oh, yes, so I'm kind of plant-based now. And I'm like, yes. And I didn't even say anything. I just led by example. So I think that's another important thing to note.
And just to specifically to answer your question too, what we're talking about is not that the ask is to think about doing this 100% of the time, 100% vegan. I think If you have a culturally important or family event, Thanksgiving, whatever it is, something that matters more to you than food choices, I think you should go with that. And the idea here is if what we do to our bodies through food on a regular basis has the effect. So if once a month you have an event where you're going and you're going to have non-plant-based foods that is not wholesome, as long as you are compensating for the following week and month, body can handle those kind of hits. A body cannot. What body can't handle is if that becomes often. Yeah. That person at the back. Yes, you.
So the question is, how can you make yogurt? Okay, because on the Instant Pot there is a feature here that says yogurt, and it's amazingly simple. I sat there and watched Kim Campbell make it in my cooking video. There's plant-based cooking with Kim and Jean, and I demonstrate not only how. And you take soy milk, one of the cartons of soy milk, and then you use it's called acidophilus, and that's the bacteria, the culture for the yogurt. You literally take the soy milk, put the acidophilus in it, mix it up in a blender, pour it into containers, put it in the Instant Pot, and hit the button. It's that difficult, okay? And then once you get the yogurt, you take this and cook it, and it cooks overnight. So before you go to bed, you cook this and put it in the Instant Pot, and you get it going. And then the next morning, you wake up, and you've got yogurt. You put it in the refrigerator, and it's going to firm up even a little bit more. And then she took it to the next level. God bless this woman. I just love her to death. She took it and put it in the refrigerator and put it with a coffee filter. And she actually found, she did a couple ways. She put it there and got the liquid out of it. And now we're talking cream cheese, okay? And to use that, and she mixes different spices in it, like a smoked paprika, things like that. We're talking Jedi level now, okay? In terms of the food. I mean, it's amazing. So, yes.
Yeah, you make up some of the coolest things. I mean, I have to say, it's amazing the things that you can make. Jedi level amazing.
I think we'll close with this. If you have any specific questions, maybe you can come and talk to us individually here. Thank you. Thank you so much for